Stop getting pharmacokinetic and pharmacodynamic confused. If you want to pass your board or your next med school exam, you will only need to remember one simple sentence. That is pharmacokinetic versus pharmacodynamic, the golden rules. Hi everyone, I'm Dr. Abu Sadat Mohammed Saim. I have a PhD degree in pharmacology and I have been a senior lecturer at the university level for years. I have seen thousands of students struggle with the basic. So I am starting this channel to make pharmacology the easiest subject in your curriculum. Uh, Today we'll try to talk about the basic of pharmacology. Let's talk about the first part, the pharmacokinetic, the what the body does to the drug. Think of pharmacokinetic as the travel diary of a drug. It's what your body does to the drug from the moment you swallow it. That means the pharmacokinetics equals to what the body does to the drug. We use this acronym that ADME. Let's break that down. A for absorption. The absorption, how the drugs get into the physiological system. More specifically, how the drug gets into your blood circulation. Second is D. D for distribution. How the drugs distributed throughout the body from the blood circulation. That is called distribution. And later on, it comes M for metabolism. How the liver breaks the drug into excretable portion, that is called metabolism. And finally, it comes the E for excretion, how it leaves our physiological system. So that is all about the ADME in short briefing. Maybe later on we can make a separate video separately on absorption, distribution, metabolism, and excretion. And also, I'll make another video, short video on the route of administration, where how you can you can take the drugs. I give you one example to describe this pharmacokinetics ADME properties. That is, for example, you have a pain, so you want to take paracetamol to treat the pain. So once you take the paracetamol orally by mouth, the this paracetamol reach to your gastrointestinal tract, GI tract. From that gastrointestinal tract, this paracetamol will reach to the blood circulation. Once the paracetamol will reach to the blood circulation, it will be known as absorption of paracetamol. That means this paracetamol will reach to your blood circulation. That is called absorption. And then after the paracetamol reaching to the blood circulation, this by the help of circulating blood, this paracetamol will reach to the site of action, that is the tissue area, the where you are feeling uh, pain. So once the paracetamol will reach to the tissue and it will reach to the site of action, it will reach to the site of pain. That will be known as distribution of paracetamol. Okay. Once the paracetamol will cure the pain, it will act on the site of action in the tissue area. After that, it will come back to the blood circulation again by the tissue fluid. Then once it will come back to the blood circulation, it will reach to the liver. In that liver, the liver, what liver will do? Liver actually have some enzyme. We'll talk in different video about the metabolism. So in that liver, this liver will break the paracetamol or will convert the structure of paracetamol in another structure or another compound, which can be excreted by the kidney so that the paracetamol can excreted out from your body. So that is known as metabolism. So after metabolism, the the metabolized compound of paracetamol will reach to the kidney or feces for the excretion or for the expel of the drugs from your body. That is called excretion. So I hope by this example you understand in short what is ADME of the feature of the pharmacokinetics. Now we'll talk about the pharmacodynamic. So pharmacodynamic actually what the drug does to the body is the opposite. What the drugs does to the body. Now pharmacodynamic is think pharmacodynamic is the action movie. So the movement of is the moment the drug finally reach its target and it starts changing the things. So it's what the drug does to the dynamite, I mean the body. So pharmacodynamic equals to what the drug does to the body. Think of receptor, signaling, side effect. If pharmacokinetic is the car driving the drug to the house, pharmacodynamic is what the drug does once it's inside the house. Uh, Look at the image. I want to discuss this pharmacodynamic with an example. For example, you take insulin. You have diabetic, type 2 diabetic. So you take insulin subcutaneously. After administering the insulin reach to the blood, and throughout the blood, it will go to reach to the cellular area. So in that area, in the cell surface, there will be a receptor which is specifically for insulin. It is known as insulin receptor. So the insulin will bind with the receptor. After binding with the insulin receptor, this binding will trigger a signal. That signal will change the receptor conform is structurally, and this signal will go downstream of the cell, and it will stimulate the glut protein. Glut protein. That protein will translocate from the downstream of the cell to the cell membrane, and it will bind with the cell membrane area. After that binding, the glut protein bind with the cell membrane, then the glucose can easily enter into the cell by the help of glut protein. So see here, actually the drug insulin, the hormone insulin, bind with the insulin receptor. Because of binding of the insulin receptor, all these changes occur, and finally glucose enter into the cell. So this total action by the insulin is known as pharmacodynamic action. So this is actually known as pharmacodynamic. I hope you understand the pharmacodynamic. So you remember. So remember the pharmacokinetic is the journey, ADME, and pharmacodynamic is the destination action. I hope you understood the discussion of pharmacokinetic and pharmacodynamic. If this made sense to you, hit the subscribe button of the channel. I am Dr. Abu Sadam, and I'll see you in the next lecture. Thank you so much.